Fibroids is also known as leiomyoma, and it is the most common tumor of women overall. The etiology of fibroid is age group between 35 to 45 years old, and it is increased if the age is more than 50 years. If the lady is having his family history of more than one female relative who has fibroid, it is associated with a chromosomal abnormality like 12 trisomy 7 deletion, associated with nulliparous women, obese women, red meat eaters, and it is also due to increased estrogen and progesterone. The pathology of fibroid is that they are monoclonal smooth muscle cells of tumor, and they always start in the intramural area of the uterus, and it forms whorls of smooth muscle cells which are surrounded by a pseudocapsule. So this fibroid is present in an intramural area, is treated as a foreign body by the uterus, and because of this the uterus responds by contracting, and it tries to push the fibroid either inwards or outwards. If inwards, then submucosal fibroid, and if outwards, subserosal fibroids. So according to Figo Classification, the fibroids are classified into 8 types. The type 0 is the pedunculated or the intracavity or submucosal fibroid. Type 1 is less than 50% intramural and rest in the cavity. Type 2 is more than 50% is intramural and a part of it is in cavity. And type 3 is 100% intramural but touches the cavity. The cavity is submucosal. And type 4 is intramural. Type 5 is more than 50%. More than 50% is intramural and rest in serosa. Type 6 is less than 50% is intramural and rest in serosa. And type 7 is subserosal pedunculated. Type 8 is when the pedunculated fibroid detaches from the subserosa, and it, for example, if it gets attached to the diaphragm, then it is called as parasitic fibroid. The type 2 to type 5 are also called as hybrid fibroid because the fibroid is present in both in cavity and in the serosa, so it is known as hybrid fibroid. For the diagnosis, we most commonly use ultrasonography, but the best diagnosis is MRI, as we can do fibroid mapping, and endometrial biopsy can be done to rule out endometrial hyperplasia if it is present. The patient mainly presents with the symptoms of pain, in which a dysmenorrhea that can be congestive and spasmodic, torsion or a compression of vital organs. The patient presents with infertility. The uterine factors gets affected, like due to increased uterine contractility, there is increase of expulsion of the embryos, and due to this there is decreased implantation and increased abortion. Bowel and bladder symptoms includes urine retention, commonly caused by posterior cervical fibroid, and posterior fibroids can also cause constipation. So there is increased frequency of urination. So for the treatment, it depends on the size of the fibroid along with the symptoms. So if the fibroid is less than 5 centimeter, no pain, bleeding, infertility, then no treatment is required. If the fibroid is less than 5 centimeter with pain, bleeding and infertility, then treatment is required. If there is large fibroid more than 10 centimeter with pain, bleeding, or infertility, treatment is required. And if large fibroid more than 10 centimeter with no pain, bleeding, infertility, then treatment is required, because in such cases it may undergo torsion or degeneration or compression of bladder or bowel, or it can detach and cause parasitic fibroid. So we can manage it medically by giving non-steroidal anti-inflammatory drugs which will decrease pain and bleeding, and a tranexamic acid which will also decrease bleeding. We can also give mifepristone, it is antiprogestin, ulipristal, which is a selective progesterone receptor modulator. There are newer methods like uterine artery embolization, which is preferably done above 35 years. MR guided focused ultrasonography is done, and surgical management, hysterectomy for the patients who completed their family and can either opt for open technique or laparoscopy. The criteria for laparoscopic myomectomy is one fibroid less than 15 centimeters can be removed, or if number of fibroid is 3 to 4 and they should be less than 5 centimeters can be removed.